Imagine waking up every morning in pain, a pain that doesn't fade, that lingers, turning even the smallest tasks into a challenge. For over 30% of the world's population, this isn't just a bad day, it's their life. Chronic pain is more than just discomfort. It's the leading cause of disability worldwide, affecting both personal well-being and economic stability. It keeps people from working, supporting their families, and simply enjoying life. But here's the thing, not everyone experiences pain equally. Women, military veterans, people with lower socioeconomic status, and those living in rural areas are disproportionately affected. Racial differences also exist due to both enhanced physiological pain sensitivity and barriers to healthcare access. So what are the solutions right now? For many, the first option is opioids, morphine, oxycodone, fentanyl. They work by blocking pain signals to the brain, but there's a serious downside: addiction, tolerance, and overdose. Even when opioids work, it can take months to find the right dose. And they don't just stop pain, they also slow breathing, making overdose a constant risk. Many turn to over-the-counter options, like ibuprofen or naproxen. These NSAIDs reduce inflammation, but with prolonged use, they come with serious risks. NSAIDs can cause stomach ulcers, kidney damage, and even life-threatening gastrointestinal bleeding. The longer you take them, the higher the risk. And because NSAIDs are available in multiple products like cold medicine or prescription pain relievers, people often accidentally exceed the recommended dose without realizing it. For those who don't respond to medication, doctors may recommend nerve blocks or even surgical implants like spinal cord stimulators, but these procedures are invasive, don't work for everyone, and carry risks. Nerve blocks, for example, are often temporary, and they don't work well if pain is misdiagnosed. So, what if there was another way? A way to target pain directly, without drugs, without surgery, without addiction. Meet Optogenetics, a groundbreaking technology that lets us control pain using light. Instead of flooding the body with drugs, Optogenetics targets the very neurons responsible for pain, turning them on or off like a light switch. But how does it work? This idea was first developed in 2005 by Carl Desserat at Stanford University as a tool to study the brain. But today, it's showing promise in something even bigger: pain management. By using genetically modified, light-sensitive proteins called opsins, scientists can turn neurons on or off with different wavelengths of light. But how does this help with pain? Pain starts with nociceptors, special nerve cells in your skin, muscles, and organs. These nociceptors detect injury, heat, or pressure and send pain signals to your spinal cord and brain through channels like NaV 1.7 and TRPV1. When these signals reach your brain, that's when you feel pain. But in chronic pain, these neurons don't shut off. They keep firing even when there's no injury. This is where optogenetics comes in. To control pain with light, scientists first introduced opsins, light-sensitive proteins, into nociceptors. Once inside, these proteins make the neurons respond to light. But how do we get these opsins into the right neurons? Scientists use adeno-associated viruses, AAVs, a harmless virus commonly used in gene therapy. These viruses act as tiny messengers, delivering opsins to specific pain neurons. The result? The neurons now have light-sensitive switches, allowing us to control pain at its source. Once the neurons are modified, all we need is light, a small implant, like a mini LED or a fiber optic cable, which delivers light directly to the affected nerve. Blue light activates neurons, increasing activity in some cases. Yellow light inhibits neurons, effectively blocking pain signals before they reach the brain. The result? No pain, no drugs, just light. There are many pros associated with optogenetics: precision, no addiction risk, and non-invasive long-term. Unlike opioids, it only affects specific pain neurons, not the entire nervous system. It doesn't interact with the brain's reward system, so there's no dependency. Once neurons are modified, treatment is controlled externally without drugs or surgery. Of course, though, no breakthrough comes without challenges. There are genetic concerns. Some worry about permanently altering neurons. However, researchers are ensuring reversibility and safety. There are potential light delivery limitations. Current implants are small, but still invasive, so scientists are working on developing wireless micro-LEDs for a non-invasive solution. Regulatory approval. Since optogenetics is new, it must undergo extensive trials before it becomes widely available. Despite these challenges, the potential is enormous. Beyond pain, optogenetics could help treat epilepsy, Parkinson's disease, and even depression. Chronic pain has shaped human history, but it doesn't have to define our future. If scientists succeed, we could be looking at a world where pain is no longer something we endure, but something we control. The future isn't in pills, it's in light.